Welcome back. The University of North Dakota is working exceptionally hard right now to slow the spread of COVID-19. They're part of a statewide effort to actually trace those who may have come in contact with COVID-19 patients. So with us now, the lead case manager for this project, Ashley Nelson. Ashley, good morning. Thanks so much for joining us today. So let's just talk about this project. I mean, it's got to be, I can't even imagine how you're managing all this. So kind of walk us through what the purpose of the project is and how it's working.
Yeah, so the state, North Dakota Department of Health has started to recruit some students to help with contact tracing. And that is basically the interviews that are happening once we know that a patient is positive for COVID-19.
So can you walk us through as sort of a layman, what does contact tracing mean? And then as you make these phone calls, what kind of questions are you asking? How does it work?
Yeah, so it all starts with a call to the patient, which happens as soon as possible. So ideally less than an hour since the results are in. So most of the time, if not all of the time, the patient has been notified of their positive result. And so we're calling them very quickly. And that first call is going to consist of asking some demographic questions, asking about current symptoms and any history of travel or illness. We also ask details about their days since they were tested, which includes, those stops for gas, groceries, talking to neighbors, a stop in the office, really anywhere that they've been outside of their home. So we'll talk a little bit about their prior 2 weeks were like, and just do our best to figure out their infectious period and the types of contacts that they've been in with people. So at this point, each conversation goes a little bit differently, but we're hoping that most people have been staying home so that these will be relatively quick interviews. So after that, we actually interview all of the household contacts, or in the case of minors, we would speak with their guardians and any other close contacts that we've identified throughout this initial interview process. So the initial interview can be a little bit lengthy, but it's really important to be thorough so we can learn as much as we can about the virus. So after all of that is done for the first interview, we do follow up with them on a daily basis to document any sort of symptoms for both the case and any of the contacts that have been identified.
So I think you mentioned you go back 2 weeks and then you ask them, where they've been, who they've been around. So within that 2-week time frame, do you reach out to say, I think you mentioned a gas station. Do you reach out to that gas station and say, hey, Joe X was there and you need to know that? Or can you walk us through a little bit of that background?
Yeah, so we don't need to, we have certain guidelines that we're looking at. So, how close to somebody were you? If you just went and pumped your gas and you didn't have any contact with anybody, we don't need to notify the gas station at this point. It's going to be more, if you went to pick up groceries and you stopped and talked to somebody that you haven't seen in a while, or you were out for a walk and you stopped and talked with a neighbor for a while. It's all going to be based on the length of conversation, how close you were, maybe the size of the area you were in. So an office versus like a warehouse. So it can get a little bit subjective, but that's where we make sure that we're doing the proper training to be able to identify how some of that is going to affect the people that they've been around.
So as you know, there's so much, I think, uncertainty, trepidation around, this whole conversation. So since you're in this conversation every day, what's the most important thing you think our audience should know or try to maybe shed some light on that maybe people aren't talking about?
Well, the big one, of course, is stay home. Practice your distancing and everything that the governor is telling us and the CDC is telling us. But I think the big thing is, when we're making these calls, we're not out to get anybody. We are just doing the best that we can from a public health perspective to get the most information on this virus so we can figure out the best way that we can combat it to keep all of our communities safe. So the big thing is just be as honest as possible with us. The new Care 19 app is a really good tool to be able to download and kind of jog your memory if you do end up getting some of these calls so that we can just be in the best position to keep our communities as safe and healthy as we can.
Ashley, great stuff. And thank you so much for joining us today. We appreciate it.
Thank you.
Thank you very much. All right, stick around. We got a lot more coming up right here on North Dakota Today.